Hi, I'm Dr. Sanjay Kumar Chugh. I'm a director of cardiology and director of interventional cardiology at a super specialty hospital in Gurgaon. And I've been doing cardiology now for almost 30 years, interventional cardiology almost 27, 28 years. And I've seen cardiology interventions evolve. I'm a pioneer of transradial interventions. I trained in Toulouse in France, and thereafter I worked at a fully radial center in Victoria, British Columbia. This was way back I worked in Toulouse in '97, and I was in British Columbia in the year 2001, 2002. Came back to India in 2002 to Escorts Heart Institute, New Delhi, and started my career in India. I was brought in to develop the transradial program. In terms of radial, when we started, there was hardly any data. There was one study which showed that hematoma is less with radials, that's all. But we were convinced about its efficacy, about its safety, and that it was better for the patients because the patients were up and about quickly. And obviously the risk of having a bleed was very less compared to that with femoral access, which is done through the groin, because in those the bleeding risk was high, and with the newer blood thinners coming up, hematomas and vascular complications were very high. Mortality was high on that account. Subsequently, we saw a lot of data come in favor of radial, and we actually developed the technique to make it painless and to make it effective for all kinds of cases, including complex angioplasty. Today we have people talking about chip CTO, and we've been doing chip CTO by radial access for 2 decades now. All kinds of cases we've done, and the best is the survival benefit, significant survival benefit by use of transradial access, which is angioplasty through the wrist compared to that done through the groin, because the risk of a patient dying is almost 50% less when we do a primary angioplasty or an angioplasty in somebody who's having a ST elevation myocardial infarction, or even in non-ST elevation in acute coronary syndrome group. The higher the risk, the more the survival benefit with transradial access. Transradial access has now been popularized, but even then, we don't find many people doing primary angioplasty using transradial access. And we've been involved with training cardiologists. Our society, the Wellness and Radial Intervention Society, has been involved with training cardiologists in transradial access, and we have a program where they come in for hands-on training as well to the centers where I'm attached. And we do this Radial Live conference every year. We haven't had one for last 2 years because of COVID, but we're going to have pretty soon, in 6 months, we're going to have a physical meeting of Radial Live, where we'll have live cases and full discussion on transradial access, and people are going to showcase their cases. And although primary angioplasty using transradial access is only 2%, but I'm sure it's going to go up in times to come, because the maximum benefit with radial access is in acute coronary syndrome, which forms 80% of our work. Radial has now evolved into distal radial access, where the access is done through the anatomical snuff box through here, and I'm a pioneer of that as well. And that has further major advantages, because forearm bleeds are even lesser with that, because it's only localized bleed that might occur. And in addition, if you've done a distal radial access from here, you still have the radial available for access if you have to access again immediately following a procedure, like if you've done an angiogram and you want to do an angioplasty. So you can do an angiogram, bandage this, and you can still go radial. So that is another big advantage. Today I'm talking about radial and distal radial for 20 minutes at the radial session this evening. And looks like it's going to be a good opportunity for me to showcase what we've done in the last 2 decades. And I'm sure it's going to be a learning experience for all the faculty and delegates who participate and are present there. And I hope we'll have a very good discussion on that, and that will make people more confident in doing transradials. If I can do it, they can do it. Thank you.